Okay.
Go ahead.
It's a great pleasure to share my knowledge with the WebSafe community. My topic today is a very classic subject, the control of the inferiors incisors in class 2 corrections, but I would like to enlighten it by the use of our modern tools, I mean TADs. I would like to start with a short presentation. My office is in a small town of the middle of France, open since 2010. It's a beautiful area near two very rich departments for their landscapes and their culinary specialties. Brive was a breadbasket for France during war. Here is my office and staff, along with my associate, Dr. Bayer, on my staff. We are Virginie, Tatiana, and Vanessa. So it's a small office, but a very good working environment. In France and more widely in Europe, we have 60% of patients who are in class 2. Having control of the mandibular incisors is one of the main goals of our treatment. In association with vertical molar control, it determines the quality of skeletal response of our class 2 treatment. It also takes part in the control of the occlusal plane, and it's essential for the preservation of the periodontium in the frontal area. Therefore, mandibular incisor control represents the key to our functional, aesthetic, and periodontal goals, as well as determining stability. The use of TADs enables us to achieve these